Hello, my name is Susan Coolidge and I'm a registered nurse. I work on an inpatient rehabilitation unit and I've been working there for about 2 years now. When I started working there, bedside shift report was a process that was already in place. Recently I've changed over to working the weekend program, and I noticed that we've been a little lax on doing bedside shift report on the weekends as compared to during the week. So I decided to look more into the topic of bedside shift report. I developed the PICO question for adult patients in an acute care setting. Does performing bedside shift report as compared to not performing bedside shift report increase patient satisfaction or foster positive experiences? I first looked into the significance of bedside shift report and I found 3 themes. The first theme was bedside shift report is shown to improve patient safety. The Joint Commission set patient involvement in care as one of the 2011 National Patient Safety Goals. Patients and their families can easily be encouraged to participate in shift report if it is performed at their bedside. Patients reported being able to point out discrepancies or wrong information when the information is exchanged in front of them. Second, bedside shift report is shown to improve nursing satisfaction. Bedside shift report can actually cut down on the amount of time spent giving report. The nurses can actually visualize what is given in report. It can also reduce the amount of subjective, speculative, and non-essential report information given. Third, bedside shift report is shown to improve patient satisfaction. Giving report at the bedside, you're able to introduce yourself to the patient. You can develop rapport with your patient. You can address any concerns, set any goals, and you can do that right at the start of your shift. So next, I performed a literature search, and I worked with the librarian at Cedar Crest College and also the librarian where I work. And I found that using the search engine EBSCOhost with the database CINAHL was successful for me. I searched the keywords bedside shift report, patient bedside, bedside report, bedside handover, handoff, satisfaction, and patient satisfaction. I limited my results to the English language and published dates between 2008 and 2016. I ultimately chose 3 studies to help answer my PICO question. The first study was by Ford, Heyman, and Chapman. It was a direct and quantitative design, and it used patient surveys. And from these surveys, it was shown that patients perceived bedside handoff positively, and the more exposure they had to bedside handoff, the more positive they were about the process. The second study was by McMurray, Chabware, Wallace, Johnson, and Gerke, and this was a descriptive case study. It used semi-structured interviews, and it found that patients felt acknowledged as partners in their care. Patients felt updated and able to amend inaccuracies. Some patients actually chose a more passive approach to bedside shift report, but most patients appreciated an inclusive approach to bedside shift report. The last study was by Radke, and this was a descriptive design. It was a pilot program, and the researchers monitored HCAP surveys at a hospital, I believe in Michigan, and they were monitoring the question, nurses always communicated well. So they monitored the question before a bedside shift report and after. The results from that question rose from 75% to 87.6% in the first 3 months of implementing bedside shift report. They did not meet the goal of 90%, but the findings still showed that the practice change impacted nursing communication positively. From these 3 studies, I developed 3 recommendations for practice. The first recommendation is to perform nursing shift report at the patient's bedside consistently, which is something I need to do in my own practice. In the study by Ford, Heyman, and Chapman, bedside handoff was perceived positively by patients only when it was done consistently. Developing a culture of always must be developed for patients to continue feeling positive about their safety, satisfaction, and understanding of care. Second, performing the process of bedside shift report in a patient-centered means. Patients expressed a desire to be involved and have access to their information. and that was in the study by McMurray, Chabware, Wallace, Johnson, and Gerke. Third would be to standardize the way report is given. In the study by Radke, a format called ISBAR, which is Introduction, Situation, Background, Introduction, Situation, Background, Assessment, and Recommendation. This was a format developed because nurses were a little reluctant to change to doing bedside shift report, so this helped reduce the anxiety of the nurses when talking in front of the patient. So collectively, from these 3 studies, I found that bedside shift report does increase patient satisfaction, and it does foster positive experiences. Thank you.